Good morning, friends. This talk is about Hydrozone and EBOO in grade 4 osteoarthritis of the knee. These patients are either unfit or unwilling for surgery. They may have medical conditions, they may have bad experiences of the relatives with failed TKR. Generally, they do not desire a TKR. In such patients, we have an option for Hydrozone and EBOO. IAOS latest EBOO is a plastic renal filter free 100% ozone compatible system. EBOO is not dialysis and there is no role of filtration of blood and tossing away liters of body proteins, calling it waste. Filtering blood with cellulose triacetate or polynephron fibrils has nothing to do with EBOO. Absolutely nothing to do with EBOO. Filtering liters of body proteins and calling them waste is unscientific. Real EBOO is 100% absorption of all ozone administered into the blood and reaching the patient's body. Filtering the blood with fibrils, rushing large volumes of low concentrations across a membrane will allow hardly 25% of the ozone to be assimilated. Using destroyer at the other end and hoping that blood is properly ozonized to high concentrations is all wrong. This video shows the complete steps of the real EBOO, where 400,000 micrograms are administered to a patient. In this particular patient, we can go up to 800,000 micrograms. Hydrozone is a combination of molecular hydrogen gas and ozone. The video shows the complete steps of cocktail Hydrozone EBOO in grade 4 arthritis of both knees unfit for surgery. The cocktail consists of xylocaine or xylocard, 2 ml, 0.5 ml of Kinacort or depomedrol and dilution to 15 ml, 12 to 15 ml with water for injection. This syringe is capped and kept away. Next is we have to mix hydrogen and ozone in 2 syringes and keep them ready for injecting. We have to lock the syringe to ensure that hydrogen doesn't escape. Lock the bivalve, fill the syringe with hydrogen, lock it, ensure that it is safely stuck, and then extract 100 micrograms per ml, 20 ml of ozone. The 2 of them are now attached in this double barrel syringe which is waiting for the injection. The knee is cleaned, sterile, and this knee has some fluid which has been aspirated. The patient is a rheumatoid arthritis patient with side swept knees for whom knee replacement was advised by many sources. This will be sent for histopathology. We now inject about 5 ml of the cocktail into the knee and then 5 ml of hydrogen and 5 ml of ozone. The same procedure is repeated to the opposite knee. 5 ml of cocktail, 5 ml of molecular hydrogen and 5 ml of ozone. One will be careful with the bivalve to ensure that everything is done right. Next step is to get the perfusion pump to a speed of about 8. Check the direction whether it is right and heparinize the saline which will be used during the procedure. This is 5000 units per ml and 4 ml which is about 20,000 units using a thick needle is injected into the bottle. The bottle is shaken so that the heparin is diffused properly. Now another 2 ml is taken and 1 ml and this is mixed with 5 ml of water for injection and will be kept safely for flushing or other activities. This is the generation Z EBOO tubes, very simple, one set for Venflon, one port to the patient and one stainless steel spike into the bottle. The bottle is now opened using a sterile artery forceps. We enlarge the holes where the spike will go, the holes where the waste will go, and then we first insert the needle into the plus symbol which goes into the stainless steel diffuser. Next we introduce a spike into the lid and this spike must be at a much lower level. And this is an ozone destroyer, ozone waste outlet, and the waste outlet tip must be at a further distance from the blood inflow to avoid capillary jumps of good blood into the waste system. We now prime the set by switching on the heparin and filling the tubes with heparin. The tube is specially made and can be put anywhere in its entire length into the machine and it will start pumping. We start the pump and see that yes, the saline, heparinated saline is coming in. We switch off the machine, we connect the ozone machine to the port. This patient is a little bulky, we will have difficulty in finding the veins. However, by adequate efforts and diligent patience, we can locate a vein, and she has located it, and she has found it right. We connect system and once it is taped, we start the ozone bubbling. Please note that no destroyer is used here, and you can see the dark color of blood that is going into the bottle. Depending on our age, comorbidities, the speed of blood flow is regulated and modulated. This is the outflow tube. This can be pushed and kept ready. From the bottom side, and we now have to wait till 50% of the bottle is full. UV lamps are switched on. The recipient side vein is located. The blood is opened up to clear it of the air bubbles, and the recipient side is attached. We can see the striking color difference and very less amount of waste that has come into the bottle. So we do not filter liters of plasma and call it EBOO. Once 40 minutes have passed, we will disconnect the donor site, lock it up, increase the pump speed to ensure that the entire blood goes into the bottle, and then we remove the piping. The heparin solution is discarded and the remaining tubing is used as a waste outlet. The blood remains continuously ozonized till the end at 100 micrograms per ml, and we can see that the blood has almost been drained. It is tomato red, so bright and comfortable. Patient has COPD also, so her chest is being monitored for the oxygen concentration. And even while this process is going on, her breathing eased up and she felt very happy. Meanwhile, she is moving her knees because she felt dramatic relief from the pain. She has flexed both her knees and she is checking. She was never able to flex her knees to this extent before. Once the blood has been transfused, we just flush the venflon, because the next day she might need nutraceuticals. The set can be discarded. The X-rays shown subsequently belong to a different patient but show the extent of results, because this patient was conducted only 3 days back. However, this patient came to me last year. This was her situation, and you can see the patient's name, standing X-ray, and this is the patient after 6 months of Hydrozone and EBOO, pain-free, walking and comfortably happy. So you can see the one on the left and one on the right. That is the degree of difference, and the dates are all right. If you are a qualified therapist or a doctor, you can message me in WhatsApp only on any of the numbers for learning how to perform either of these procedures for the benefit of your patients. Have a nice day. Bye.